Our research project focuses on the risks and benefits of exome testing in general practice. The purpose of this research project is to find out what the participants deem to be the risks and benefits of genetic testing. We did a cross-sectional survey conducted over 2 days to assess the participants' ideas on the benefits and risks of genetic testing in general practice. Our population of choice was the staff and students of Tygerberg Medical Campus and Hospital Complex. A survey questionnaire was conducted to capture data on respondent demographics and participants' personal responses about the risks and benefits about genetic testing. The sample size was 78 people, out of which 36% were staff and 64% were students. Females were 72%, males 26%, and 3% unspecified. 69% were between the ages of 18 to 25, 14% between 36 to 45, 8% between 46 to 55, 5% over 55 years, and 4% between the ages of 26 to 35. Of the 78 participants that filled in the questionnaire, only 58% had ever heard of genetic testing and only 3% had ever been offered genetic testing by their general practitioner. Good knowledge regarding genetic testing was found to be limited at just 6%. Majority of the participants had less than average to almost no knowledge. Most of the participants said they would consider undergoing genetic testing if advised by their GP, with 50% saying they would go if it were life-threatening and 42% saying they would go if they were symptomatic. We did not add an option for those who would go for testing if they were asymptomatic. We do, however, assume, based on the above results, that it would be less than 1 in 2 individuals. 80% of the participants thought that genetic testing would be beneficial if either one of their parents had an inheritable genetic disorder. Only 49%, however, said that they would go for testing if any of their relatives, excluding biological parents, had tested positive for a genetic disorder. 55% of the participants would consider genetic testing of the fetus to assist in the termination or continuation of pregnancy. 48% of the participants said they would rather not know if any of their siblings tested positive.
A positive result can lead to psychological imbalance in the patient, and this can further determine whether or not the positively tested individual decides to disclose the results to their family. 51% of the participants think that this is reason enough to withhold information, with 5% strongly agreeing. A positive test can influence discrimination by one's employer and/or insurance company. 72% of the participants think that an individual that tests positive should not have to disclose those results to either their employer or insurance company. Because genetic testing reveals the gene makeup of not only the consented tested individual but also their immediate and relative families, individuals are often conflicted as to whether they should seek consent from their families before testing and whether they should disclose the results to their families. 63% of the participants think that one does not have to seek consent from their families before getting tested, and 45% think that they don't have to disclose the results to their families. When an individual seeks genetic testing for a particular disease or cancer, there are chances that there could be other positive incidental findings which they did not consent to. Doctors are not obliged by the law to reveal these incidental findings. However, ethically, it could be of benefit or not for the patients to know the results of these findings. When asked, 89% of the participants said they would want to know all the results, including the incidental findings, and only 11% would seek results for only which they consented for. So in conclusion, the participants deemed genetic testing to be beneficial in screening and detecting for genetically inherited diseases and/or cancers for which the individual has not yet presented with symptoms. It allows for such individuals to seek preventative measures as well as prepare themselves and their families psychologically for late-onset inheritable diseases such as Huntington's. Majority of the participants believe that one is not obliged to disclose their positive results to their employer and/or insurer due to fear of discrimination. From this survey, it is evident that majority of the participants believe in confidentiality with regards to seeking genetic testing, However, a higher percentage of the participants believe that this is within their and their family's best interest to share the results.